Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you, Katie.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering a viewer-submitted question, answering and addressing the latest headlines, and looking at our lone COVID statistic through today, September 12th. We invite you to submit any questions or suggested topics down below via Facebook at NU Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Starting today with our abbreviated COVID statistic. Average COVID deaths per day in the last reported week were 129. In the same week of 2023, there were 152 average COVID deaths per day. Dr. Murphy, your reactions to those numbers, as well as the general state of COVID in the country.
Yeah, so this is it's not surprising because what we're seeing is in the wastewater surveillance, which tells you how much is going on in the community, is starting to decrease. So in the northeastern part of the United States, it went from very high to high. So it was down a notch. It's still very high in the West, Midwest, and the South, but it is starting to trickle down. So what happens, the only metric we can really follow now is our deaths. That's because that's the only thing that's reportable now. So 129 per day translates to 47,000 people per year. That's a lot. That's a lot of deaths. But so in the summer wave that we had, which is now starting to go down, when a person gets sick, first they get exposed, then they get sick, then they get really sick, then they end up in the hospital, then they end up in the ICU, and then, some people don't make it. So it takes weeks after they get infected before the mortality rate changes. So you'll see the mortality rate is the last thing to change. So it's the last to go up and the last to go down. So I think we're just moving towards the end of this summer wave. It's going to be just in time to get the winter wave. So the new vaccines are out there. They work quite well. It's probably a good idea to get your flu shot and the new vaccine to avoid getting infected in the first place.
Mm-hmm. And on that note of vaccination, there's been talk here and there about COVID or vaccines cause all of these different problems, including autoimmune disease was one of the theories, I'll say. However, there was a new study just on this subject. Could you break it down for us?
Yeah, this is a very large study from Singapore. It's a very good medical system. 1.8 million adults were followed. They did find a slight increase in inflammatory bowel disease and a skin disorder that causes blisters. But overall, looking at 12 immunologic diseases, autoimmune diseases, they didn't find any significant increase in those that were vaccinated. Now, we know that COVID is associated with all sorts of things that can aggravate underlying autoimmune diseases and has all sorts of problems. But the vaccine really didn't really do anything. And then where they looked at it, they found some just kind of funny things. For instance, they did find this slight elevation in the inflammatory bowel disease and these skin disorders, and then, but they didn't find it in people that had the booster shots, the second, after you had the first two vaccines. So, it really doesn't make any sense. But the bottom line is 1.8 million people, there's no big increase in any of the 12 autoimmune diseases. It's not caused by the vaccine.
Mm-hmm. And we did have another COVID question submitted from one of our longtime viewers, so thank you. They were wondering how you can find out what kind or strain of COVID you have.
Yeah, this is a good question. It's relatively easy to do. I mean, if you have a sequencer machine sitting in your laboratory, you have to do genomic sequencing to actually figure out what kind of strain you have. And this is done routinely by public health laboratories to see if there's a new variant coming. The manufacturers of the vaccines have to adjust based on the strain type and whatever. But for all practical purposes, there's no reason for somebody to do it because the treatment and the way you handle a person, it has nothing to do with the strain at this particular point. Now, maybe at some point, if the virus mutates and one of them is more serious or something, that could change a treatment parameter. Maybe if there's a worse strain, people would be more likely to take the antiviral treatment, like Paxlovid. It can cost up to $1,000 to do the sequencing. So, I mean, it's not to be taken lightly, and your insurance is not going to cover it. And basically, there's no reason for an individual to do it at this particular point.
So interesting to know, possibly, but it doesn't have any effect on how you would be treated with
Right.
COVID.
Mhm.
Now, one of the biggest stories we've been talking about for months now and this week is H5N1, the avian flu. And
Mhm.
specifically this week, there's been quite a mysterious human case. Can you tell us about that, the case specifically, and then the standing of H5N1 in the country?
Right. So avian flu is a disaster for birds and can infect cows, which can infect the milk. So it's mostly dairy herds that they're finding this in. It's really been devastating for the poultry industry. Um, if adults get it, adults are getting it from the animals. They're getting it from birds or they're getting it from cattle, dairy farm workers. And there's been 13 or 14 of them already reported. All of them have survived. But in cases of bird flu reported from Asia in the past, the mortality rate was up to 50%. Now, but it has never been known to transmit human to human until now. There's one case in Missouri where they're not reporting it even in the cattle there, where a person came in, had the flu. They tested. You have to do a special test for avian flu. This person had it, and this person had never been exposed to either birds or cattle or milk, from a dairy farm. So this is very disturbing. They're doing the sequencing of that virus right now. We'll find out if it is the one circulating in dairy herds. We don't know yet, but it's very disturbing. Now, there are stockpiled millions of doses of vaccines specifically for avian flu, several million doses. So the health authorities in the country have done this just in case this happens. Because if this happens, this could be really bad. And what they're afraid is that if this starts happening to any extent and during the regular flu season, which starts in November, December, are these viruses in a person going to mix and mutate and become even more lethal? So anyway, we'll see what happens, but this is something that has to be watched very closely.
Absolutely. And the patient has recovered, so that is good news. But
That's good
again,
news.
very, very
And
mysterious
the
and
other
alarming
cases
stuff.
from the cows, not one person has died. So this old number that has been thrown around, 50% mortality, I mean, that's what everybody's afraid about, but that is not seems to be the case.
Now, focusing more in on poultry, not the avian flu, but there has been reports of other contaminations regarding eggs. Can you tell us what bacteria is at fault here and where these reports are coming from?
Yeah, this is due to an infection with Salmonella, the bacteria. 65 cases reported so far from 9 states, including Illinois, Wisconsin, Michigan, California, Colorado, Iowa, Minnesota, Utah, and Virginia. And it all got traced back to a poultry farm in Wisconsin called Milo's Poultry Farms. And it was sold under the trade names Milo's Poultry Farms, but also Tony's Fresh Market. If you have any of these products, throw them away. And anywhere where those products are, clean the area very closely. And if you get sick, go immediately to the hospital because salmonella can be very serious. So in these cases that have been reported, of them, 24 of the people, like over half, have been hospitalized. Now, nobody has died, but it can be, you can get sick enough where you end up in the hospital. So they've shut down this poultry farm, and they're doing a deep clean and throwing away all the products, and the stores are supposed to be throwing away all their products. So it's not good.
Definitely not good, and something to keep your eye on if you did just recently buy eggs, make sure they're not those ones. But zooming out and looking at North America as a whole, there have been additional reported cases of the Oropouche virus since we last discussed it. Can you update us on those cases and remind us what the virus is?
Yeah, so Oropouche virus is spread by midges, which are little insects, a little bit smaller than a mosquito, and you get very vague symptoms, headache and fever and muscle aches. It's rarely fatal. However, if you're pregnant, it can cause problems. So in pregnancy, they've reported with this virus, similar to Zika, 11 fetal deaths, 3 spontaneous miscarriages, and 4 cases with congenital abnormalities from women who got infected while they were pregnant. So as of September 3rd, there were 32 notifications from 3 states, all from travelers. So most of the cases have been from Brazil. 80% of the cases have been from Brazil, 8,000 cases. But the Dominican Republic, so in the Caribbean is reporting, Cuba, Peru, all these countries are reporting it now. So it's another thing to be concerned, particularly for pregnant women.
Mhm. Wear your bug spray, people. Do what you can when you're traveling and outdoors. There's a lot of mosquito-related
Yeah.
diseases, not just, in different areas, but here in the US and all over the world. So something
Right.
to keep in mind.
Uh-huh.
But another thing we have been discussing on and on, deservedly, is the Mpox outbreaks currently ongoing. The first donation of vaccines just came through to Congo. Can you tell us how many doses were sent and what impact they can have?
So yeah, this epidemic is centered in Congo, the Democratic Republic of the Congo, and they have no vaccines, no treatment, and they finally got some vaccines delivered to them. We've talked about this in the past with the WHO dragging their feet and getting approval of these vaccines, and meanwhile the country went and just approved it, and they got vaccine in the country, 100,000 doses. Manufactured by Bavaria Nordic, a Danish company. It was donated by the European Union through their health emergencies unit. Another 100,000 doses are expected to be delivered this weekend. And the ball is basically rolling. So this is a drop in the bucket. The Congolese people think that they need at least 3 million doses to get this thing under control. It's a very devastating disease, and it can cause fatalities. So they've reported 4,900 confirmed cases, and 629 of those have died. That's 12.8%. So it's a nasty disease. It's like smallpox. I mean, it's a terrible, debilitating, and potentially lethal disease. So now there's 20,000 cases in Africa altogether. Even Nigeria has reported 40 cases this year. So it's different from the global outbreak. It's a slightly different variation. The strain is what they call 1B, is most of them 1 or 1B, and the strain that occurred globally among men who have sex with men was the strain 2. So that had a very low mortality rate, but it's it is a problem. And finally, people are addressing this issue and getting serious and getting the vaccines to where they're really needed.
Mhm. Now, a bit of a technical question about some of the numbers, the confirmed versus reported. Obviously, Mpox, you can, see it, there are lesions. Are
Mhm.
those confirmed tests ones that have been laboratory tested and the reports are, how does that work out?
Yeah, well, I mean, confirmed and confirmed means you have had a test. And but actually, I'm not sure if they how they're actually what the definition of confirmed is. It can be when there's an epidemic, you don't have to test every single person. But that's actually a good question, and I'll find out. We can talk about that next week. But
Awesome. Yeah.
confirmed means the person has Mpox.
Yes.
And it could be. We'll get the actual definition next week.
Mhm. Our final story today is on the discovery slash identification of a novel orthoneurovirus. I hope I said that correctly. Can you please tell us what it is and about the identification itself?
Yeah, so this was reported in the New England Journal of Medicine. It's called now it's called wetland virus, WELV. Spread by ticks. It was reported from Mongolia and China in 2019. It's highly pathogenic to livestock. Humans, get sick. There have been 17 cases from 4 areas in China have gotten this disease. It's like everything else: fever, dizziness, headache, malaise, muscle pain, arthritis, and back pain. But in the patients that have been diagnosed with this, they've found low levels of white blood cells, low number of platelets, which can cause bleeding, and high levels of inflammatory markers in the blood. So that denotes a seriousness in this disease. So this is just another disease that has to be followed now, and we'll see if how difficult it is to spread, and if it
Mhm.
leaves that region of the world.
Well, thank you very, very much, Dr. Murphy, for your time and expertise, breaking down the latest headlines, addressing the COVID statistics, and answering our viewer submitted questions. It's much appreciated.
Thank you.
And thank you all for joining us for this week's episode of the Ask Dr. Murphy series. If you have any questions or submitted or suggested topics, that you'd like to see discussed by Dr. Murphy, please feel free to comment them down below or send them to any of our social media linked in the description. We hope to see you back next week and have an excellent weekend.
Have a great weekend.